This week we're going to be talking about evidence-based practice and theory and application of theory in practice, research, organizations, and education. The term evidence-based practice started being used in the 1970s by Dr. Archie Cochran. Dr. Cochran focused on critical review of research, especially randomized clinical trials, to improve medical practice. So, evidence based practice has been a term that's been around since the 1970s. However, its application in nursing has really only grown in the last 10 years. So, what is evidence based practice? It's based on the premises that health professions should not base practice on tradition or belief, but on information that's grounded in research. Evidence based practice is not synonymous with research. Research focuses on the discovery, whereas evidence based practice really focuses on the application. Evidence-based practice involves identifying a clinical problem, looking at the research and critically evaluating what literature's been is out there and the research that's been done, and then trying to determine appropriate interventions. So evidence-based practice does integrate research, theory, and practice. So, what are some good resources for evidence based practice? Things like the Cochrane Collaboration, which is a database of systematic reviews. Again, if we talk about the triangle um, in the front of the book, you'll notice that Cochrane Collection or systematic reviews are at the top of that pyramid. Also, the Agency for Healthcare Research and Quality, which is AHRQ, is also a database of evidence based clinical practice guidelines. So, some people argue that evidence based practice looks like cookbook care and you lose the art of nursing, lessens the attention to holistic care. The healthcare reimbursement might drift exclusively to interventions sustained but as evidence, and not all healthcare practices can or should be based on science. What about the care? However, we do want to provide patients with appropriate interventions that have been tried, true, and proven by the research. Practice based evidence is a relatively new concept, and it's based on the observation that many interventions have limited formal research support. So, practice based evidence recognizes the importance of the environment in determining the practice recommendations. The premises of practice based evidence is that large databases should be reviewed or mined to gather data on quality and effectiveness. So, what are some of the sources of practice based evidence? Things like benchmarking data, clinical expertise, cost effective analysis, medical record data, national standards of care, quality improvement data, as well as patient and family preferences. It's more comprehensive picture than just randomized clinical trials. And this slide just represents the relationship among practice, theory, research, and the practice-based evidence-based practice cycle. You'll hear a term called evidence-based practice models, and the goal of these models are to create or establish evidence-based practice protocols, procedures, or guidelines. And some of the models focus on implementation of evidence-based practice in the setting or institution instead of the actual establishment of the protocol. Common evidence-based practice models used in the literature are some of the ones below, especially in Doctor of Nursing practice programs. You'll hear a lot about evidence-based practice models. Some of the most common ones include the Iowa model and the Stetler model of evidence-based practice, as well as Johns Hopkins Nursing evidence-based practice model. And there's also the A-STAR model, as well as others that are listed. So, looking at the Iowa model that was developed in the 1990s, its intent was to promote quality care through research utilization. It was developed to provide guidance for nurses in making decisions about practice. And this is just a diagram of the Iowa method of evidence based practice. It's an algorithm basically to show you how to implement the Iowa model. The Johns Hopkins Nursing Evidence Based Practice Model is a problem solving approach to clinical decision making, and it combines the nursing process, the ANA standards of practice, critical thinking, and research utilization. It basically has three core elements, which is a practice question, evidence, and translation. There are several phases that are composed of 18 steps, and each step helps to clarify the process. This model begins with a PICO question, which is the practice question, which is patient population problem, an intervention, comparison as appropriate, and desired outcome. And other steps involve defining the scope of the question, assigning accountability for leadership, recruiting a team, and scheduling conferences. The Statler model began in the 1970s as a quality improvement movement, and there are 5 steps or phases to the Statler model, including preparation, validation, comparative evaluation, translation, and evaluation. So let's talk a little bit about the application of theory in nursing practice. As we've discussed throughout the semester, there's a relationship between theory and practice, that theory and practice are inseparable. The development and application of theory and research based practice are necessary for the development of the profession and autonomous nursing practice. How does theory influence nursing practice? It organizes nursing care, sets standards for practice, specifies actions to be completed by nurses, and describes clinical problems to be considered. It also describes settings in which practice should occur, identifies recipients of nursing care, sets nursing process format and content, and specifies systems of nursing care delivery and client classification systems. So, a lot of theory in nursing practice is implied theory, those theories used by practice and nurses during routine care. Frequently, theories used in nursing practice are implied and extrapolated rather than explicitly stated, such as the nursing intervention classification system. It's a comprehensive list of more than 550 nursing interventions grouped into 30 classes and 7 domains. The Nursing Intervention Classification System is a research based, standardized classification of interventions for nurses, can focus on physiological issues, psychosocial, treatment, health promotion, illness prevention, as well as individuals as well as families. And here's one example of a nursing intervention classification as well as the possible theory base. So, where's theory and evidence based practice? In practice based theory, such as micro theory, prescriptive theory, or situation specific theory, it addresses a specific phenomena, is limited to a special population or practice area, may use knowledge from other disciplines, and is developed from experimental research. In nursing, theory and practice are inseparable. To improve practice, nurses need to continually search the literature, critically appraise the research findings, synthesize empirical and contextually relevant theoretical information to apply in practice. Nurses should always seek ways to enhance the knowledge base that supports practice and bridge the theory practice gap. So let's look at the use of theory in research. So, descriptive theories would be more useful in descriptive or exploratory studies. Explanatory theory would be useful in correlational studies, and predictive theory would be useful in experimental or quasi experimental studies. Descriptive theory looks at phenomena and identifies its major elements or events. It does not explain why. So, descriptive research involves observation of a phenomena in its natural setting, and the methods include concept analysis, case studies, surveys, phenomenology, grounded theory, ethnography, and historical inquiry. Explanatory theories specify relationships between the characteristics of individuals, groups, situations, or events. They explain why and to what extent which one phenomena is related to another. Correlational research measures dimensions or characteristics of phenomena. In correlational research, data is generally gathered by observation or self-report instruments, and the instruments can be fixed choice, open-ended questionnaires, or structured interviews, and statistical analysis is used to measure association. Predictive theories move beyond explanation to prediction or relationships between characteristics or phenomena among different groups. Experimental research involves manipulation of phenomena to determine how it affects or changes dimension or characteristics of another phenomena. So, experimental research requires quantifiable data, and statistical analysis is used to measure the difference. So, how is theory used in research? Theory brings organization to the variables of interest. Theory provides a guide for developing a study, or theory allows the findings to be placed in or linked to a larger body of knowledge. So, theory is used in the research process in one of three ways. Either theory is generated as the outcome of the research study, research is undertaken to test a theory, or theory is used as a research framework as the context for a study. It is possible, however, that research generates a theory, and that's usually descriptive research, and it's undertaken to develop and describe relationships between and among phenomena, and it's inductive. And there are several steps in theory generation research which are listed above. Theory testing research. However, studies can be conducted to test a theory or assess its explanatory value in a specific situation, and the theoretical statement is translation into questions and hypotheses and is deductive. And this slide includes the steps of theory testing in research. However, the most common way theory is used in research is a conceptual framework for a research study. A theory is used as the context and basis of interpretation of the research, and the theory guides the study and enhances the value of its findings. And the next couple of slides include all the steps of using theory as a framework for research. In writing a research report, you want to illustrate the impact of the theoretical framework in the research study and show the context within which the findings should be interpreted. Discussion of theoretical framework should be incorporated into several sections of the report. In writing a research report, these slides will discuss how you can incorporate talking about the theory throughout different sections of the research report. And now let's talk about application of theory in nursing education. The theoretical base of a program provides a framework that helps nursing students define professional philosophies and values. A program's theoretical base identifies and describes the essential concepts and significant problems, and a program's theoretical base influences the ways in which the material is presented and learning is evaluated. Nursing education theory strongly contributes to the content and structure of the curriculum, known as the curricular framework, and instructional processes and strategies used to teach students. Components of a nursing curriculum include the philosophy or mission statement, the organizing framework, the outcomes, competencies, and objectives, and content and sequencing strategy. Other components of the nursing curriculum include education activities to facilitate learning, resources that will be used, responsibilities of the teacher and the learner, how and where learning will take place, as well as the methods of evaluation. The curricular of most nursing programs is based on the Tyler curriculum development model from the 1950s. It focuses on organization of the material in a logical manner, uses instructional objectives, and evaluation of behaviors if objectives have been met. The Tyler model was fundamental in setting criteria for certification organizations such as the NLN or the CCNE, as well as the state boards of nursing, and it determined rules and regulations that covered minimal hours in clinical settings and competencies or skills needed by students. In the 60s through the 80s, the work of theorists such as Roy, Oram, Rogers, and Newman served as curricular framework, and during this time, nursing education promoted theory development in searching for the ideal way to structure curricula. And as you well know, LMU undergraduate work is based on Sister Calista Roy's adaptation model. No matter which theory or framework is used for a nursing program, it should discuss the knowledge essential to nursing, the concepts, principles, skills, and theories, and how it should be linked with other knowledge, facilitate the sequencing and prioritization of knowledge, and give students organized, content, and cohesive learning experiences. In a study of nursing programs in 2002, the nursing process was the curricular framework for 55% of programs, simple to complex for 37%, biopsychosocial model for 36%, and nursing theorists for 33%, Oram, Roy, Watson, and Newman being the most common theorists. And again, Clarissa Roy is the model for undergraduate LMU. What you find in master's programs are that they're based on multiple theories, not just one certain theory. So, in looking at programs, they use multiple curricular frameworks sometimes. In using theory to look at curricular sequencing, it may be based on the meta paradigm concepts. It may be the attributes of the person, whether it's individual, family, or community, the activities of the student organization, and first that they're an observer, then a participant in the care, and then the actual practitioner, as well as complexity, or they may start with few variables such as a minor health problem to a mid-level to a more complex care, which we find in our master's program. Nursing instruction itself has three main components: learning, cognitive, content, acquiring psychomotor skills, and application of content and skills in practice. This cognitive content is conveyed through lectures, discussion, program learning, and as well as reading assignments. Skills are taught through demonstration and return demonstration. Practice application is the application of content in a clinical setting or the demonstration of skills in a clinical setting. Again, in conclusion, hope you've learned something today about evidence-based practice, as well as the use of theory in practice, as well as research and nursing education. If you have any questions about this presentation, feel free to email me. Thanks.